You just, hopefully the side effects are positive,
Right,
where,
right.
you know, your pep and energy are restored.
Yes.
You get a better outlook on life. Your some of the drives that, you know, they're in terms of business and home life are improved.
Everything. It really is everything.
That's
And it impacts one thing, it impacts everything.
That's right, yeah. And
Right.
a person's self-esteem is better if they're able to be a good mate sexually.
Yes, a mate.
Yes, it has a lot to do with a person's self-esteem outside of the household.
And really conversely, if they are having a problem, then the next time they're up to perform and they can't, it's like the spiraling.
There's nothing
terrible.
better than a good performance.
Exactly.
Some of the biggest problem with sexual performance is performance anxiety, where if a person fails, and nobody's going to be 100% all the time,
Right.
but if there's a failure in there, a person handles that differently, and some people can shy away from trying again because they don't want to fail.
Right.
So avoidance is a kind of a natural method that people use in terms of handling poor sexual performance.
Instead of really what it comes down to is know your numbers.
That's right. That's
know
right.
your numbers, and whether this is cardiac or whatever, it's know the numbers. And for this, it's know your hormone numbers.
Well, and also, you know, some of the things we have to treat erectile dysfunction, such as Viagra, Cialis, or anything else, they may mask the hypogonadism, but a low testosterone in men over a period of time can result in, again, a higher body mass, you know, a BMI.
Oh, yeah.
It will, there can be demineralization of bone. There are psychological things that go along with it, depression. So you begin to manage the downstream consequences of hypogonadism, where you really have to get to the problem. So you can sometimes correct the erectile dysfunction with Viagra. Sometimes it works. Yes, but it works. And so a knee-jerk reaction to use the medication can be a trap. So you have to look at the whole patient. You have to look at their immediate problem, and then what is really going on with this patient?
That's the key thing, though. What is really going on?
Exactly, and that's what Dr. Guy did in Harvard, put 2 and 2 together, and I think he came up with a very revealing cluster of male-related problems. And it's a lot of work, it's a lot of things to solve for the patient, but especially if you get a person in their 40s, with potentially 40, 50 years to live if they take care of themselves, it can be a game changer for them.
Exactly right.
Yeah.
Right. Okay, so know your numbers on that. We're going to slide into the next part, talking about know your numbers. And if you're just tuning in, I'm Liz Aiken in a heartbeat. I have Dr. Tom Mertz with me, who is a urologist. And it really does come down to know your numbers. So we're going to throw a few more out to you. You can catch them. We're going to talk about PSA and BPH, and you're going to describe what the heck does that even mean? PSA, BPH, what are we talking about?
Well, PSA is prostate-specific antigen. It's a test.
Prostate-specific antigen.
That's right. It's an enzyme that's produced by the prostate. It shows up in the seminal fluid in high concentration, but it's in the bloodstream in some form, at some level. So getting a blood PSA is it's a marker, it's a way of judging the prostate gland to see if there's any sign of prostate cancer. PSA came out as a popular tool back in the 80s, the late 80s.
Right.
It became available commercially, and then we learned more about PSA and began using PSA as a part of screening for prostate cancer in the early 90s. And today, a lot of what we thought was normal back when we started the screening has been fine-tuned to some new data today that I think everybody should be aware of.
So let's talk about, let's get the numbers on that.
Okay. First off, in the general population, people not at high risk for prostate cancer, about 1 in 12 men will be diagnosed with prostate cancer sometime in their lifetime. Okay. So it's a very prevalent disease. As you get older, if you look for it, you'll find it. But it's of very little consequence in terms of major treatment. Sometimes you have to acknowledge it's there, you can follow it, but it won't require any major surgery or radiation. It can be followed, especially in older men in their 80s and up. Right. But where prostate cancer really has an impact is people with a life expectancy of 20 years or greater. If you catch cancer in that age group and you're able to cure it, you will save lives later on.
And life quality.
Yeah, well, yeah, absolutely. If you catch it early, they won't be dealing with it later on.
Right.
So, but the new guidelines have identified people that are higher risk for prostate cancer should be checked at age 40, and that the age-adjusted normal for PSA at age 40 would be 2.5 or less.
Okay, so it used to be 4.
That's
and
correct.
Now it's 2.5.
That's right. So if I see a male,
change.
if I see a person,
right,
and he's 45 years old, he has a PSA of 3.7. I don't look at him the same way as I did before, and it's not normal. And if he and they may need some additional testing to see if they do or don't have prostate cancer.
All right. And then we've got about 2 minutes to talk about BPH, but I want to, before we end the PSA, I want to talk about detection versus prevention. And that's really a misnomer, you're saying. Prevention is totally a misnomer.
In all honesty, I don't think you can prevent prostate cancer. I think you can do things in your life to reduce your risk there, such as diet and controlling obesity, and possibly using supplements that will provide the natural antioxidants and the elements necessary for good prostate health.
Right. Such as what? What would that be?
Well, it would be lycopene, selenium, vitamin E, vitamin D, soy isoflavone. These are all things that, given in the proper balance, could help a person nutritionally, as well as a low-fat diet and maintaining a normal body mass index.
Now, when you even talk about the nutrients, I know that a lot of times people buy expensive nutraceuticals, vitamin supplements, whatever, and they come out of the body the way they went in. So I said, if you actually know a name of a product, I'd like to hear the name, because that is, you want something that actually, if they're going to buy it and they're going to take it, they want it to go in and actually go somewhere and be of value.
The supplement industry is a multi-billion-dollar industry in the United States. You hear them they're in the paper in the sports section.
Totally.
You hear them on air all the time. And really, a lot of what's out there is junk, because there's no FDA screening and approval of the product. The product has to have, truth in advertising says, it has to have some of what they say is in there, but the consistency of the product is quite often very poor.
Wow.
But there's a company by the name of Theralogics that makes supplements that we have confidence in, and we try to point our patients toward those products, because their quality is high, and they're effective.
Spell the name of the company, because it's
T-H-E-R-A. No, it's not.
This is reality.
Theralogics. T-H-E-R-A-L-O-G-I-X. And they have you can get them on the web by theralogics.com.
Okay. And I want to make a point that this is not like commercial for that, but I'm specifically saying to him, because I see this too, that you see pills go in and pills come out. We see them. And you think, well, I don't think there was much in the sugar coating that was of value to that patient, and the product within is history.
That's right.
So when there is something, and you see it by your outcome-based measurements that it is effective, that's what. All right, seriously, we have like a minute or two to talk about BPH.
Okay.
Can you believe it that we're going to move on to stones? BPH.